Now we're going to look at how to be inclusive for learners with dyspraxia in your teaching practice. These are some ideas about initial diagnostic assessment of dyspraxia for educators in further and higher education. In your initial diagnostic assessment, be aware that a dyspraxic student may have difficulties with perception, coordinating different parts of the body, laterality, manual and practical work, handwriting, language, concentration, short-term memory and sequencing tasks, organisation and thought, response to external stimulation. So what you can do about it to help the learner. There's special guidance with regard to their capability of successfully completing the course within your organisation, formal tuition in the planning and organisation of work, strategies to compensate for poor memory and organisational skills, training in relaxation techniques, assertiveness and confidence. Strategies should be in place to see that students can handle cooking and laboratory equipment safely. They should be entitled to extra time for their coursework and exams, and have access to either a word processor or somebody to take their notes and write them for them if necessary. If the student needs to apply for these concessions, they should seek a cognitive assessment from a clinical or educational psychologist. Dyspraxic students in higher education can also claim a disabled student's allowance. Further reading, Living with Dyspraxia, a guide for adults with developmental dyspraxia, can be found.